We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together. Welcome to the Healthcare Revolution podcast. Today I have with me Aubrie Coleman. It was such a joy to be with. She is a patient of ours, and she has such a unique story to tell us and has been through a really hard journey and been through some really tough things. And we want her to tell her story to connect the community on these rare diagnoses. We're seeing these types of diagnoses more and more through post-COVID symptoms, but is what she has is what's called Ehlers-Danlos syndrome, EDS, and we'll define what that is here in a minute, but then also POTS, which is positional orthostatic tachycardia, and she has a lot of other things on top of that we'll talk about as well. But these medical diagnoses are coming up more and more. We're seeing there's more in the community, and we don't really understand why. But they're a little bit difficult to manage, and it takes a team to work together. And one of the biggest things that I've noticed as worked with this population of people is that they have to be in the driver's seat. They have to learn from experiences with different providers. They have to learn what makes sense with their bodies, and we have to really customize the treatment to them. So all of that said, welcome, Aubrie, to the podcast.
Thank you for having me.
It's so great to have you here.
I'm excited to be here.
The stories I can tell about this girl, we're going to dive into them. But let's just start out with the first one. I mean, so you came into PT one day, and we started treating, and I can't even remember what we were doing. I think you were it was the end of the session, yeah. And you were just sitting on a heat pack. I was finishing up my documentation, and then you got off the heat pack, stood up, and all of a sudden just started having a seizure.
Yeah.
And I think one of my colleagues pointed out to me that you were on the ground.
Yep.
And I looked down, and sure enough, you're having a seizure on the ground. And so I come down, kindly attend to you. Turns out, Aubrie stops breathing. And, I'm medically trained for this. I know how to handle it. A few of my other colleagues come over and say, do you need any help? And I just said, oh, this is routine for Aubrie, right? And for another patient to see this is like scary. It's like, oh my gosh, what's happening over there, right? But the way we handled it was just, this is routine, and this is just what we go through, right? And she stops breathing. You stop breathing, and I'm in my mind, I'm like, okay, start counting. How many seconds here? 7 seconds in, and she's not breathing. So I'm like, all right, it's time to intervene. And I did what's called the sternum rub. So I took my knuckles and dug into her sternum, and she immediately took it, gasped for air. But yeah, yep. Thank you for putting me through that experience. That was really awesome. Tell me, let's first define EDS. What is EDS? What is POTS? Talk to me about the other diagnoses that you have had and learned about.
Yeah. So my Ehlers-Danlos diagnosis came way after I got sick. It started with the vascular compressions. Mm-hmm. So I was sick to my stomach a lot, blood flow issues.
So how does that happen? How does that vascular compression happen?
So
your vessels are just compressed?
Yeah, so I explain it as if you imagine you've got your driveway and you're watering your grass. There's a hose across the driveway. Mm. If you pull your car onto the hose, you're lacking water to the grass, right? But then you're also damaging
your grass
the hose.
Is dead. I'm really serious about green grass. You should see my lawn. It is pristine green.
I'm not surprised.
I'm obsessed with it a little bit.
But yeah, so then there's damage caused to the hose. You're not getting your grass watered. And so that's basically what was happening internally. So my vessels or veins or arteries were smashed by either muscle or organs, and it causes lack of blood flow,
And for those
nerve
who don't know, like
damage.
blood flow is everything.
Yeah.
That's what you get oxygen from,
Right.
nutrients from. It literally is food to the body. And if you can't get blood flow, naturally, what's going to happen?
It causes a lot of issues.
Yeah.
Yeah.
So tell me more.
So I was diagnosed with 2 vascular compressions, one that affected my digestion and then one that affected my left kidney. So we didn't know why or what had happened. But I had a couple surgeries, abdominal surgeries, and my Ehlers-Danlos syndrome diagnosis came later on, and that kind of was able to explain
When
everything.
was the start of these surgeries?
I got sick in the fall of 2021, and then I had my first surgery in August of 2022.
And tell me about that first surgery.
So I had, we fixed the compression called MALS. It's a compression of the celiac artery. So that branches off of your aorta. And that takes blood flow to a lot of your digestive system.
What I love about people with your diagnoses is you guys talk like you're medical doctors. I love it.
I've learned a lot.
But you talk in layman terms, so the majority of people actually understand what you're talking about. Most doctors don't know how to talk about it.
Well, I'm just not the smartest cookie in the jar, so I figure it out.
But yeah, you're talking about the celiac artery coming off the aorta. Like, that is huge. Okay, keep going.
Yeah, so what they did was they basically went in and they just cut out all the nerve damage that had been caused by that compression. And then they also relieved that.
And just so everyone knows, like, when you compress a nerve, it doesn't get the nutrients that it needs and it actually dies. And that's kind of what you had, right? We had to actually remove some of those nerves because they were damaged.
Yeah, they removed a lot of nerves. And then, they cut a ligament that was causing that compression, and that relieved it so that I could have blood flow through my artery again. So they did that, and I was feeling good for a couple of weeks. And then I ate breakfast one morning and was in excruciating pain. Like I was in so much pain. And that started a whole new series of going to doctors and being told that everything was normal. Like I just needed to eat more.
What were the initial symptoms before the first surgery? What got you into a medical provider in the first place?
I was having really bad headaches. I also had a ton of pain in between my rib cage, like right underneath my sternum. And I would blow, like my belly would get so distended. I would eat like bread, like a piece of bread or like something really small, and my stomach would just get like so bloated. I went to my senior prom and I had to put an elastic around my button of my pants because I couldn't button my pants up.
Because you're so bloated.
Yes.
So you got fitted and then all of a sudden
they were a little bit too small. So
good way to fix it.
So yeah. But so those were like my main symptoms, just a lot of pain. I played soccer my whole life, and running was really hard, really painful in between.
And we're talking high level athlete, right?
Yeah.
Water skier. She's really good at water skiing. And soccer player.
Yeah.
Like this is not some sedentary individual that's just sitting at home. Sedentary being defined as not doing a lot, right? You were very active. You were very engaged, very, doing the things that you need to, exercise on a regular basis. And then this just sprung on you, right?
Yeah. So it made playing soccer really hard. Running was really painful. And I just knew my body so well from being an athlete that I just knew something was wrong. Like there was that physical pain, but then also just intuition. I just knew that something was really wrong.
Yeah.
So I went to my primary care physician. He ran some tests, tried some medications. They didn't work. So I was sent to a GI. Same thing. We did all the tests, all the scans, all the medications, and nothing was working. And then I was diagnosed with those 2 vascular compressions. And we had decided to just take care of that one in between my rib cage because that was causing the most pain. My the vein that supplies blood to my left kidney, the left renal vein, was also smashed, compressed, but we didn't really want to mess with my kidney.
Is it because your muscles are too big? They're just compressing everything? I mean, that
muscles.
makes sense to me.
So we just did the mole surgery, and then I was.
Did you do that locally, or did you have to fly out?
No, I did it in Salt Lake.
Okay.
It was just a laparoscopic surgery, so I just had 6 little tiny incisions, and yeah, it was honestly, recovery wasn't too bad. It was pretty. I don't want to say easy, but it was pretty chill. And then about 2 weeks after surgery, I ate and was in excruciating pain, like screaming, crying, like in so much pain. So we went and saw my surgeon, and they just said it was normal recovery pain. So we went another week, and as the weeks went on, I was eating less and less and less, and my pain was getting worse and worse and worse, and to the point where I was put on a feeding tube because I couldn't eat. I was just in so much pain. And so I was tube fed through a tube down my nose. And I had that until I got some more imaging done and found out that I had developed a third vascular compression.
Third time's a charm.
Third time's a charm. And it has been, actually, as far as that goes.
Yeah, that's great.
But my small intestines were compressed. So couldn't eat.
These medical doctors that you're working with, these surgeons, do they have any kind of reason why this happens that they told you?
No. From like what I've kind of researched and learned about, sometimes it can happen because of weight loss. Sometimes where they cut that ligament to relieve the first compression, it can kind of offset things in your body, organs. I guess. Yeah. And so
potentially that surgeon that surgery could have led to this other complication, which led to another complication.
Yeah. So it kind of just snowballed. And then because I was so malnourished and sick and just the tube feeds weren't going great, my pain with that left kidney compression got worse as well. So I was to a point where I was in excruciating pain. I was dying. Like, I was so sick. I could hardly get out of bed. I was just so sick.
Yeah, your strength was gone. You just couldn't do much at all.
I was like skin and bones. Like, you could see all my ribs. Just, I was so sick. And so we had met with another surgeon who did my second surgery. And they went in and they rerouted my small intestines. And then they took my left kidney out. And then they moved everything down and put it in my pelvis.
So now you got a kidney in your pelvis.
So now I have a really good 2 truths and a lie.
That's a good party trick.
Yeah.
You know, we've all got to have one of those.
Yeah.
Okay, so third surgery, it worked.
Second
surgery. But then led to another surgery.
So, well, it led to my CSF.
Tell us about the CSF. Define that.
So CSF leaks are cerebral spinal fluid leaks. So there's connective tissue that surrounds your spinal cord.
You're doing great. Keep
right?
going. Yes, absolutely.
Okay. And this is where my Ehlers-Danlos diagnosis came in. I started having these symptoms. I was having really bad headaches. I felt like my head was sitting on my neck. I was really tired. Really heavy. Yeah. Like, I felt like a lot of times, like, I couldn't even hold my head up. My neck was just like under so much strain. And this is where I ended up in with Dr. Colby and was diagnosed with Ehlers-Danlos syndrome. And because of that, it caused that connective tissue around my spinal cord to become really weak. And somehow a tear happened in that and led to all of the fluid in my head that holds your brain up. It was leaking out. So it's causing my brain to just sit on my brainstem.
So, and for those of you that don't know the neuroanatomy here, the brain has to have a certain pressure of fluid in it because the brain just sits on fluid and it can shift different directions. And same thing with the spinal cord. And it captures all that fluid inside the system. And when there's a leak, the pressure changes and the brain can sink down into the brain stem. And when there's pressure on the brain stem, all bets are off. I mean, there's so many symptoms that can come from this. We're talking stroke symptoms. We're talking hallucinations. We're talking passing out, like blacking out. There's just so many complications that can come from a cerebral spinal fluid leak.
Yeah.
So it's kind of a big deal.
Yeah. So that started causing seizures, the pseudo seizures, a little bit different than like a grand mal seizure because they affect different parts of the brain. So I started having those.
How often were your pseudo seizures?
I was having like daily, multiple times a day. So I was having a lot of those. And I was just in excruciating pain all the time. My head was just like hurt so bad. And I remember seeing my MRI next to like a regular brain, and my doctor calls it squanch brain because like my brain was just squanched. Just
so
like
it looked
that.
really good.
Just like,
it looked super strong. It made sense.
oh yeah. Yeah. So we started doing some procedures for this CSF leak. So they went in and they put a big needle in my dura mater, which is like the in between your spinal cord and your dura.
Yeah, but it's
Right.
pretty much like a piece of connective tissue
Yeah.
that keeps all the spinal fluid in.
Yeah.
And dura stands for tough. So dura is in Latin, or most of anatomy is in Latin, but dura means tough and mater means mother. So in English, that would be tough mother. I don't know
Mine's
why.
not tough mother.
But if you've ever pierced through dura mater, you know why they call it tough mother, because it is so strong. If you ever get like a spinal tap, or and when women have a baby and they're getting an epidural, when they go through with the needle, they can literally feel it puncture through because it's like pushing through a wall because it's a really tough structure.
Gotcha.
So they took the needle, they put it through the dura mater.
So they put it through there, and then they took blood out of my arm and they put it into my dura mater. And I just laid there on my stomach on this table until the pressure in my like pelvis, my hips, my back was so intense that I couldn't handle it anymore. And then they pulled it out. So that's called a blood patch. So they did a blood patch, and the goal with that was for the blood to kind of just flow through that space and find that leak and clot. So like a Band-Aid, basically.
Yeah, because if it's continually leaking, you're going to feel all these symptoms because the fluid's going to go up and down.
Yeah.
Your headaches will go up and down. Your seizures will change. So if there's constant leaking, it's very similar to the knee or any joint in your body. Your joints all have fluid within them. But if there's a leakage within the system, you can imagine leakage in your car with your oil in your transmission, right? If there's constantly oil leaking out, if you're not adding oil, there's some really serious things that can happen. And that's why this blood patch was so important, to essentially seal up that leak. Can you define EDS for us? Like what are the symptoms? If someone has EDS, what are the symptoms of it?
Yeah,
What are the other ones?
The interesting thing about EDS that I've learned is
because most people don't have cerebral spinal leaks
Yeah.
with EDS.
Yeah, so the biggest thing I've learned with EDS is that it ranges so vastly from patient to patient, which makes it really challenging, I think, for healthcare providers and also for the patient, because everyone is so different. So for me, most of my pain was in like my back and my chest, my shoulders, but some people are wheelchair bound that have EDS, and some people, like right now, I'm able to lift weights and
water ski.
And water ski. Yeah, but it's...
You should see your water ski. It's really cute.
It's awesome. It's fun. I'm going skiing.
I think we have to tell the joke about the... I told Aubrie that I couldn't ever get up on a slalom ski without getting up on two. And tell her what you told me.
A slalom ski, if you didn't know, is one ski. So you sit in the ski with your feet like this. And yeah, so Brad was like, yeah, I'm going slalom skiing in a few weeks with my buddy, and I can only get up on two skis and then I have to drop one. And I was like, what? Like, that is the craziest thing I've ever heard. That's harder.
Keep in mind,
opinion.
I've done that my whole life.
His whole life. And I'm just like, what? And so so my parents live on a water ski lake, And there at the lake, we have this, we call it the easy rope.
The short rope is what you told me.
No, the easy rope.
The easy rope, right.
And it's a triangle, and you put your ski in this triangle, and it keeps your ski upright for you, so it's easier to get up. And so I was like, oh, do you want my easy rope?
Yeah, just keep in mind, I did not use the easy rope.
You didn't use the easy rope when you got up.
Yep.
But
there was some coaching that needed to happen there. And I definitely learned knees to your chest.
Knees to your chest.
And also, you don't have to keep the ski straight up in the air. It can go to the side. And then number 3 I learned is let the boat pull you up. So many people say that, but not too many people really know what that means. Like my buddy that was teaching me, he's actually owns a ski lake as well, and his son was teaching me. He's like, this is super simple. Let me just show you on land. And he handed me the rope. No, he actually sat on the ground and he had me on the opposite end of the rope, pull him up. And he's like, I'm going to show you how it feels to the boat. Mm-hmm. You're the boat. I'm the person. I'm going to show you how it feels when I try to fight it. So he pulled on it, and I was like, it took me everything to get him up. Mm-hmm. But then he's like, now I want you to, I want to show you what it's like to let the boat pull you up. And he literally like creates an anchor point, and he just lets the water pull him up out of the water. And it was so easy to pull him up. And it was like finally clicked for me. So for the record, I did not use the short rope. I actually got up.
You got up. Yeah, I was sitting on one of the treatment tables, and I was like, you just gotta like sit with your knees to your chest. And he's like, how do you sit like that?
She's like talking about being a ball. I'm like, I don't know how to get in that ball, but now I understand.
But now you get it.
Yeah, I got up multiple times that day, and I realized like you get exhausted. It is an exhausting sport.
Yeah.
And like the cutting drills, like in and out of the buoys, there was the wide buoys and then the narrow buoys. I could barely do the narrow buoys. Yeah. Like it was tough.
It's awesome.
To like cut back and forth.
It's fun.
But I'll get there one day.
You will.
Okay, so what are the other symptoms of EDS? Let's dive into that. Because EDS is really the spectrum, right? Where people are like way advanced, wheelchair bound, and then there's people like it doesn't affect them at all. But what are like common symptoms that you've heard over the years?
The biggest one is just all over pain. That's what I've experienced. Like
everything hurts. Kind of like fibromyalgia.
Yeah, and like joints like coming in and out and just making lots of popping and clicking.
That is definitely one of the most number one things that we see with people with an EDS diagnosis, or you're on a spectrum. We call it a Baton score. So pretty much, can you touch your pinky to your wrist if you were to bend it back? Can you touch your thumb to your wrist if you can bend it back? Do your knees hyperextend? Do your elbows hyperextend? So we have this Baton score to guide us, but there's an additional score with EDS that we do as well. But that's one of the biggest components. If you have hyperlaxity, which just means that you have a ton of motion in your joints, that is an indicator that you could be on the spectrum. But it is a spectrum. Like it's so wide. So just because you may have an EDS diagnosis doesn't mean you're going to be wheelchair bound. Doesn't mean you're going to have what Aubrie has. It just means that you might have really lax joints. But there's a lot that we can do to manage that. And we're going to talk about that later in the podcast. But okay, so we got the EDS diagnosis. We got to the third surgery. Where are we at now?
Blood patches. So we did blood patch number 1 and 2. So I had them done like 6 weeks apart. My first one worked. I had relief for like 10 days. And then, which I was told would probably happen. They call them blind blood patches. You don't know where the leak is, and you can't see it on a CT or an MRI or anything like that. And so they just go in blind. So they put the first patch down on my lower back. I don't know how it goes. L spine.
Mm-hmm. Yep, the lumbar spine.
And then the T spine is the middle.
T spine's the middle of the back. C-spine. And C spine's the neck. Good job.
Should go to medical school.
Yeah, you still can. There's time.
I do hair.
If you need a good hairstylist, Aubrie's your girl.
Yeah, so they went in my L spine first, and then we went into the T spine for my second one. And my second one lasted. So really, I was feeling pretty good, and I didn't have those symptoms of the CSF leak anymore, and so I kind of was okay with kind of having just like aches and just kind of weird things every once in a while, like with my stomach or different things like that. But I was feeling really good after that second blood patch. So I was like, cool, let's like move to Hawaii. Let's go to school, and ended up going to hair school, started having some symptoms again, just not really feeling super great. And then I actually just kind of like left it. I was just like, whatever. I moved down to Provo in April, just this past April, and started having really weird symptoms again. So my head started
I usually
to hurt.
get those symptoms when I go down to that area of town too.
Anything past the point of the mountain? Yeah.
I'm never going to live that joke down.
No, and I won't either. My dad is the exact same way.
Okay. He gets these symptoms when he drives to Provo as well? Okay.
And also,
I think it's pretty
anger symptoms.
Universal. Yeah, there's a lot of symptoms that come on anytime I get past Orem.
Yeah, it's crazy down there. But I
think the pressure is different. I think there's something different in the water too.
Gotta be. Gosh, it's gotta be. But I started having, well, it was actually last fall was when I came to you here one time.
Mm-hmm.
Yeah. And I was kind of not doing great. My body was hurting a lot, but I was in a position with school where I just couldn't commit to being at physical therapy, and I lived forever away. So my body was kind of starting to hurt. I thought it was just from doing hair. I started getting really bad headaches again. And then like my all over like body pain was like getting worse pretty quick. And I didn't know what was going on. So I went and saw my doctor in April. We got a CT, saw that I had another CSF leak because I had squanch brain again. So
hate that squanch
brain. Gosh. And then my doctor also told me that it was likely that my EDS was taking a bigger toll on my body. And so we decided to do another blood patch. We also decided to do steroid injections and start physical therapy. And so that's when I was put into the hands of Foundation Physical Therapy.
Let's go. Now the journey begins. Where all the fun happens. And it has been a journey, and it's been so incredible.
Yeah.
So tell me, let's just walk through the physical therapy. Like why physical therapy with people with symptoms like you? And we actually didn't talk about POTS. Let's talk about POTS, and then we'll dive into the how physical therapy can help and how it helped you.
Yeah.
What is POTS? Yep.
Positional orthostatic tachycardia syndrome. So basically, my heart rate just goes crazy, and I get really dizzy, really just weird symptoms. But most of the time, I usually when I'm going from sitting to standing or laying to standing, it affects my heart rate. It also, because of that, affects I black out sometimes, pass out. Sometimes I'll have those pseudo seizures. And POTS is another one that I think affects people differently, on a wider range of symptoms. But yeah, for me, it's mostly exhaustion. Sometimes when I'm in I call it a POTS flare, lots of high heart rate and passing out.
What do you feel? What are your symptoms? Because obviously you're not sitting here checking your heart rate. Maybe you have a watch that can check it. Maybe you don't. But what are the symptoms you feel when your heart rate's just through the roof?
I get really dizzy, lightheaded, kind of blackout. Sometimes I'll be oh, I'm going to pass out. I might have a seizure. My heart just I get jittery almost because I feel I just drank a bunch of pre-workout and my heart is just going crazy and kind of hard to breathe. It kind of sometimes feels just some sort of panic attack, but it's not anxiety or panic.
Yeah,
it's just
so
my
it
body.
Feels very different.
Yeah. But yeah, sometimes it doesn't really affect me that often. Sometimes I'm in a bad flare where I have a seizure in the office and stop breathing.
Yeah, don't be doing that.
Yeah. So, but for the most part, those would be my main symptoms are the dizziness, the lightheadedness. If I'm dehydrated or behind on electrolytes, I get really...
So there's a lot of management here.
Lots and lots of management. Yeah. And
you start
management
to
for
get to know
POTS,
your
EDS.
body
like,
really well.
Yeah.
And you know your body better than any provider does. And that's what's so incredible.
Yeah.
And if we do a good job as providers, we all teach you that. Like, you know your body well. You teach us. You tell us what symptoms you're having. You tell us the patterns that you're noticing, because we can't treat you well unless you give us that information.
Right.
So, okay, let's dive into PT. Tell us your symptoms that were matched up with PT. Like, what were we treating? How did it help you?
Yeah, so I still remember when I came into the office the first time in April or May, I couldn't sit up straight, like good posture. My back hurt so bad. I was so tight and so tense. My sternum and my chest hurt. Like I could not sit up because I was in so much pain. And I was kind of just like in this mindset before I went into physical therapy that I was going to feel like this forever, because it just felt like it was getting worse and nothing could fix it.
You told yourself, yeah.
Yeah, and I think I also kind of got, and we've talked about this, I kind of got caught in that like just the like cycle of pain means procedure, means medication, it means treatment. And I've learned since that the pain doesn't always mean that you have to go and have surgery or procedures. And I think for a while I was in that mindset because that's literally what we had to do. Like my pain did mean I did need to have surgeries and I did need to have those procedures. But I got to a point where my mindset was just like, if I'm in pain, that means something is really wrong and I'm going to have to go get more needles in my back or something like that. And then I came to physical therapy.
That makes me anxious just hearing.
Yeah.
My goodness.
Yeah.
Yeah. Just the thought of like, oh, there's that symptom. Now it's going to lead down to this deep, dark path again.
Yeah.
Tell us your activity level when you first started therapy. Like, were you still just like super fatigued? You weren't doing activities, like it was really hard for you, low weight, all those things?
I couldn't really even lift weights. It hurt so bad. And then I was walking a lot, but my back hurt so bad from walking.
And it hurt to work too, because you're using your hands.
Yeah, hurt to do hair because my arms were up and standing. Or even like if I was standing, my back hurt. If I was sitting, my back hurt. I was just in so much pain.
Yeah. That makes it really hard. So tell us about the things that you did in therapy and what you learned from it in general.
Yeah. So we started, it was a kind of like a collaboration in the beginning with doing the steroid injections and then also coming to PT. I think the steroids helped kind of loosen everything up, but in physical therapy, I literally learned how to use my muscles in the right way for my body.
Which sounds kind of crazy because you got like this high-end soccer player.
Yeah.
You know, the water skier that can ski without the short rope and super strong, right? But tell us what that means. Like you learned how to use your muscles.
Yeah, I learned that my body is different than it used to be, not in a bad way, but it's different. And so there were things that I did have to reteach my body and teach myself that I didn't ever have to think of before. You know, when I was playing soccer before I got sick, like I was running like 10 miles a game and we would go from weightlifting to 3-hour practices. I was playing 6 days a week. Like I was an athlete. I was strong and I didn't have to think about what muscles do I turn on? What muscles, how do I use this certain muscle to help with my back pain? Like all these different things. I never had to think about that. I didn't even know any of that was a thing. Like my body just felt normal. I didn't have to think about it. And then I learned in physical therapy that because my body's different now, there's new and different ways to use my muscles to support my body because it's lacking in one thing. So how can we make it stronger to kind of even it out? You know what I'm saying?
So there's a portion of you just learning how to stabilize.
Yeah.
Right? Because with EDS, you have a lot of motion in these joints, whether it be in your sternum joints where your ribs connect to your sternum or your ribs connect to your spine in the back. You have excess motion, right? So teaching those small muscles to stabilize those areas is super critical because if there's excessive movement, then it causes excessive pain. Right. So we got to get those joints are meant to be very stable joints, but in your case, they're very mobile joints. So we had to counteract that with some stability type work.
Yeah, which I like never knew. I never thought of it that way. And at first, like I was like, how am I gonna do this? Like this makes no sense. And I remember Casey was working on me one day when I very first came in, and he was like, this is like a superpower. Like this is cool that you are able to like have these this mobility, but with every superpower, you have to learn how to use it. And that has like stuck with me ever since that day that I was with Casey, because it made me feel like I'm in control. My body doesn't suck. I just have this interesting thing about me that now I get to learn how to use in ways that can really be a benefit to me.
That's so powerful. You do have superpowers. I totally agree with that.
Shout out Casey.
The thing is like we, when you get these intense diagnoses, you just unfortunately I see a lot of the population with this medical diagnosis really go downhill and stay downhill, and it changed their life forever. They end up in bed, immobilized, and a lot of them are young girls just like you, and it's really sad to see that they become this victim, right? And this belief system that they begin to, you could say, inherit, that they adopt it and they choose it, and they choose to continue to be this victim. What I love about you and your story is you say, this is a superpower. You look at it in the positive light and you say, yeah, this is kind of a bummer, but this is a cool superpower, what I can do with it. And what an opportunity to say, I'm going to figure out how to stabilize this. Right. And a lot of people, maybe the people are listening to this, will be like, oh yeah, she's made it through. Right. The journey still goes, right? The journey still continues. We might have, tell us about your chest and back now that you've been through the PT with that.
Yeah. It's like, I would say 95% of my pain is gone, which I never thought would be like a possibility for me, truly. And being 21 years old, walking into physical therapy, I'm like, I'm going to be in pain forever. And when you're in pain for years, like it is a lot easier to believe that, because you keep trying things that just aren't working. And I think that's where it was so cool to learn in physical therapy that sometimes, like I mentioned, pain doesn't always mean procedure, or that, something is so seriously wrong. It's been hard to, physical therapy has been hard, but it's been the coolest thing because that's all it took.
I thought you were going to say it's the coolest thing because I get to hang out with you guys. I mean, that really went a different way.
Second, but yeah. But yeah, it really is like, I never thought physical therapy would make like such a difference, but it's literally changed my life and like changed the state of my body and my ability to work and do what I love, water ski, lift weights, like all those things that I thought would never be a possibility for me because of my diagnoses.
Yeah. And which is such an incredible story. What do you hope that maybe someone just got a diagnosis like yours? What do you hope that they knew about anything that you've learned through your journey?
There's a lot I think that I would tell someone, but I would say the biggest thing is, first of all, to make sure you have people in your life that listen to you and validate you and hear you. But then to understand that just because you got a diagnosis that's probably hard doesn't mean that it defines you. And it doesn't mean that it will change your life in only negative ways.
Because it opens so many more doors to other things.
Yeah.
So many more opportunities. We're going to this gala. Is it gala or gala?
Gala.
Okay, you corrected me on that before. We're going to this gala in next weekend that's about improving research for these populations, these underserved population of people that are often feel like they're pushed along the way, not validated, dismissed. Like these symptoms aren't real, you're making these up, this is just anxiety, right? All these things. Tell us how you feel about those types of things. Like, you go into the emergency room. You've been in the emergency room a lot, right?
Yeah.
Medical emergency. We'll talk about, the one you had this is the last weekend here in a minute, but tell us about what you've learned as you've worked with medical providers. And we use this terminology of who you want on your bus.
Yeah.
Tell us about that.
Yeah. Advocating is sometimes exhausting because, especially when you're doing it yourself. And for a couple of years, I was advocating for myself. It was hard because doctors, I do believe that every doctor is amazing in their own way. And I think medical providers are awesome. And I'm thankful for every single medical provider that has been placed in my path. Advocating is really important. And like you said about the bus, it is hard to find the right people, but when you do, whether they're medical providers or not, that is what kind of is like kept me going.
Yeah, I love that. So we talk about this bus idea. Like you're the driver's seat as the patient.
Yeah.
You don't let anyone else drive your bus. Mm-hmm. You get to choose who's on the bus with you. Mm-hmm. And it's an amazing thing because it's your choice. Yeah. You get to choose when they speak. You get to choose when you want their advice. Mm-hmm. You get to kick them off the bus if you don't like them. Mm-hmm. And that's really what we're advocating for is you're always in the driver's seat as the patient. You get to make these choices. You get to decide when you're going to turn left and turn right. Yeah. You get to decide the mindset in which you operate in your life. And don't let anyone else disrupt that. Mm-hmm. But ultimately, you get the choice of who you want on the bus too. And you want people that are going to validate you. You want people that are going to help and assist you and, help you along your way and be your biggest cheerleader and say, keep going, even when things are hard and tough. You know what I mean?
Yeah. Yeah.
Pause just for a second. Are we good, Lauren?
Yeah. Yeah, we're good.
Good to keep going?
Mm-hmm. Yeah,
okay.
Sorry.
So tell me your thoughts. Anything else you'd add to that?
Yeah, I do love that analogy of being in control because I think for a little while I was in this space of like, I will do anything. Like, I don't care what it is. Like give me the medications, give me the procedures, give me, all these different things. And it took me a long time to learn. It was when I was on all those medications just a few weeks ago that were just like killing me. That's when I learned that, yeah, you can stand up for yourself and say, even if you have, amazing doctors, if you don't like the way your care is going, you get to control it and you get to find doctors and you get to find things that work for you, medications or not.
What advice for you or would you have for people that don't feel like they can do that? They don't feel like they have a voice. It
took me a pep talk from you to really be like, I was like, okay, I can do this. I can stand up for myself. You really do, I think, have to figure out what's most important to you. And then you just have to be brave and just do it. That was hard for me. I'm a people pleaser and I also wanted to feel better.
Not a people pleaser at all. But yeah, I mean, ultimately you had to say, this is what's important to me. And this is where I want to go with my care. Mm-hmm. Right. And your provider was fully supportive.
Yeah.
Right. It's like, I love that. Thank you for advocating. Thank you because sometimes as providers, we're just looking for input. Right. And that input guides everything that we do. Yeah. Because ultimately, again, you're in the driver's seat. You're the person driving this bus. And I'm just here to help you navigate the way. Right. Because every patient is so different with these complex diagnoses. But ultimately, if you give us good information, you get a really good outcome.
Yeah. And I think it's especially important to remember that doctors, especially ones that have a lot of patients with these complexities, they have a lot of different things that work for a lot of different patients, but it doesn't mean that what works for one works for everyone. And that's where advocating is so important because, maybe I'm on this set of medications or something that worked for my other patient, but it doesn't work for me. And that's fine, but you have to voice that. Like, you have to be able to say that. And I have learned after a couple of years of feeling like no one listens to me, there are doctors and there are physicians and there are people that will. but you have to be able to stand up for yourself and advocate for yourself first and find those people who are willing to take the backseat in your bus.
Absolutely. Because sometimes we're in the back seat and that's totally fine. Like, I'm totally cool being on the back row and you just let me know when you need me. You know what I mean? Like, I'm totally that guy. And I hope a lot of us are. Like, we're okay with not being in the front seat because we got to know what lane we're in and what seat we need to be in at the right time. I definitely don't want people to misinterpret you when you say advocate, speak up. What does that look like? How do you actually make that positive? Because so often when you feel dismissed from a medical provider, you just like want to be a jerk back and you're like, no, and you demand it, right? But how do you do it in a kind way that can get you the outcome that you're looking for?
I think first of all, understanding, and like I had this experience when I was in the hospital this past weekend. I was like livid at this doctor in the hospital. Like, he's an idiot. Like, I was so angry, and I remember you were on the phone and you were like, Aubrie, it's okay. Like, it's fine. But ultimately you have to understand that these doctors are here to help you. And sometimes they just don't know how because you're not giving them feedback or input, or it's their first time seeing a patient come in who's got POTS and EDS and vascular compressions and her kidneys in her hip and like all these different things. And I think it's important to remember that first and foremost, that these doctors, they're trained, they know a lot, but it does take collaboration and you have to be willing to have an open mind, which is something that I think I struggled with for a long time. I was very much like, if you make me mad or if you don't listen to me, like, I want nothing to do with you. I don't want you to be my doctor anymore. Like, and like, I do like look back and I'm like, I understand how I felt that way, but at the same time, no one gets anywhere with that. Like, you're not going to get anywhere with that. So really it is, I think, so important to understand and remember that your medical providers are there to help you and you have to be willing to also help them.
All right. So my question is, if patients that feel that they can't advocate for themselves, I don't want to like the pendulum swing so far where people think that they should just be rude to healthcare providers. But what advice do you have for those types of people that feel like they need to advocate, but they're a little worried?
Yeah. I think the most important thing I've learned is that medical providers, your doctors, your physicians, like, they are here to help you. That's their job, is to help you feel better. But if you aren't able to collaborate with them and work together with them, they don't know how to help you. And then it becomes this, you're frustrated or they're frustrated or whatever. And when ultimately they're just trying to help and you're just trying to feel better. And so being able to have that open mind and understanding and remembering that they're here to help you, but they can't do that unless they know what's working for you and what's not working for you and what makes you feel better, what makes you feel worse. They need information, and we have to be willing to give that to them and be patient with them, and they be patient with us.
Yeah. And ultimately, sometimes they need the information from the other providers.
Yeah.
Because they might only have a portion of the story. And I truly believe most healthcare providers are acting in the best that they know with the information that they have. Even if you bring up more information, they're like, well, based on the information that I've gathered and your exam, it's not appropriate to do that. But tell me what I'm lacking, right? Mm-hmm. And it needs to be this collaboratory experience. Let's talk about your experience over the weekend that and lessons that we learned from that to be able to instill within the healthcare community. Tell us what happened.
So it was Sunday and I've had this rash on my face. It's been really annoying and it makes me feel ugly. So I went to the dermatologist.
No one noticed, by the way, just so you're aware.
So I went to the dermatologist. I was given an antibiotic, and this was my fault from the beginning. I asked him, like, I have a lot of health issues. Like, will this have an effect on anything? And he was like, no, just make sure you're eating yogurt to replace like the good bacteria in your stomach. I was like, okay, cool. So it was my mistake. I should have checked to see more about this medication, but I didn't. I wanted this rash gone. So I took this.
Keep in mind, she didn't know this at the time.
Yeah,
So
I did not know this at the
after
time.
fact.
Yeah. So I took the pill. My friends are over at my house, and I've already been struggling with like some like CSF pressure stuff. So my head was already hurting a little bit, and then I started to get like a really bad high pressure headache. Like I was like, my head's gonna explode. And so I'm sitting on the couch, and my friend is showing me nails that she's like, oh, I'm getting my nails done in a few days. Like, what do you think about this? And I could feel myself like drifting. Like I was like, something is wrong. And I still have these pseudo seizures every once in a while. I had them a few times in the past
All
couple
your
of weeks.
friends are all trained on this, right?
Yeah, my friends aren't trained.
They're like, oh, it's normal.
They're newer friends, and so the first time it happened, I was like, how do I explain
Is that
this
how
to
you
them?
break
Like,
in dates when you take someone, or then they take you on a date? You're just like, yeah, I'm just gonna break you in. Let's just go into this.
yeah, I'm like, all right, how do I induce one of these? So I was on the couch, and I was just like, holy, like I actually like don't feel good, and it felt different than when I'm about to have one of these pseudo seizures or pass out or something. So I get to a point where I'm like, I noticed that my face, the left side of my face was like drooped, like my eye was like drooped, and I couldn't feel my arm, and I couldn't move my hand, and I was like, I felt like I was in and out of consciousness, and so I was like
slurred speech.
And
medical providers, they know these symptoms.
Yes.
This is stroke-like symptoms. So when people say these things, it becomes real serious.
Yeah, so I actually texted Brad, and before I really like.
And just to advocate, we usually don't give our cell phone numbers out. Aubree's just kind of a rare case that needs a little bit extra help with decision making sometimes.
Yes. So I was like, hey, just so you know, my left side of my face is drooped. Slurred
speech.
Slurred speech. I feel like I'm not even really alive. Like something is weird. And I think I'm going to go to the ER. And so then I was like laying there.
Yes, should I go to the ER?
Oh, yeah, I did ask that. Should I go to the ER? And before I knew it, I'm like, I was just gone. I was just out of it. And Nat, my friend that was with me, she's on the phone with you. And she's like carrying me out to the car.
So you don't remember the other part?
No.
Oh, there was definitely another part.
What happened?
So as soon as you text me, I called you. And I said, Aubrie, what's going on? And you were very overwhelmed and very anxious, and you were crying. And
typical.
and couldn't breathe.
Okay.
And that's when I said, Aubrie, you know how to calm yourself down.
Oh, I was in the car. I remember this. Because I remember I was laying like this. And my eye, like I can't see out of my eye.
And first I said, smile. Can you smile? And half the face goes up. Slurred speech, arm numbness, all the symptoms of a stroke. And I said, Aubrie, just remain calm. Natalie, I think was your friend. I said, Natalie, just bring her to the emergency room. And I'll call the charge nurse so that way they know you're coming.
Yeah.
And why don't you stay on the phone with me so I can keep talking to Aubrie? So I jumped off the phone, just kept you on the other side of the phone call. Talk to the charge nurse. Just let them know about your medical complexities. Mm-hmm. I said, this gal's coming in. She has some complicated medical history. She also has not been treated well in the ER. I just want to prep you for her before she comes in. So she took down those notes, which was really helpful. They had their team ready. Mm-hmm. And I said, Natalie, when you get there, just get Aubrie in a wheelchair. And at this point, keep in mind, she'd blacked out. She's no longer conscious. Poor Natalie over here. She's doing great.
Oh, she did
I
phenomenal.
give her like 5 stars. And I've dealt with this many times, so it didn't really affect me, although I do care about you. I knew everything was going to be okay, but she got the wheelchair, got you in, wheeled you in. And I was on the phone with Natalie. I said, just keep me on until the pass off to, I think it was Maddie. That was the charge nurse. And then things passed off.
Yeah,
so,
I wasn't greeted with Maddie. I was greeted with a different charge nurse.
I think I just barely got off the phone with her, and she wasn't running yet.
It was pretty. Things got a little heated for a second in the lobby of the ER.
It's like, oh, what's going on?
Yeah, but then I was like, I kind of remember being there. You guys got there
too fast. I think Natalie's a lead foot. She was just
and she was driving
a
Tesla, and she was just.
She told me 5 minutes. I thought I had plenty of time.
Yeah, so we got there, and I still had no, like, I was like, I did not know what was going on. Taking that medication was not like a thought in my mind that would do anything to me. And so we're in there, and I was just like, I mean, they're poking me, they're taking my blood sugar, like all these things. I'm in and out, and my eyes droopy, and there's just like, it was very overwhelming, but I was just trying to like stay calm, like everything's fine. I finally kind of got myself relaxed a little bit, enough, and then the doctor came in, and he was like, what's going on? I was like, I don't know. Like, I can't use my face. But yeah, so I don't think I did the greatest job this week, and it was a good learning experience for me, but advocating in a kind way.
Mm-hmm.
But it also was so helpful to know that I had you, and you had called my doctor, who was able to call the hospital. And that to me was like, that is what a care team is about. Is you're my physical therapist, but you were also able to advocate for me, and also manage things and kind of get things where they needed to be in order for me to have a decent experience there.
Yeah. And maybe not a 5-star experience, but
No.
it was coordinated care. And that's what we're striving for. There are people that have missing pieces to the puzzle,
Mm-hmm.
and we're here to bring it together. But what an incredible story. And you're just such a joy to be around. And I appreciate you telling your story and being willing and being vulnerable. And that's what the revolution's all about, is bringing us together as providers, the patient included. The patient's driving the bus, and we're all just a part of it. So thank you for joining us on this podcast today. We appreciate you.
You're welcome. Thanks for having me.